Dear organizer, friends of Interclean China, I'm happy to speak on the behalf of Clean Hospitals for this forum. And of course, it's a pity that I cannot be currently in China in real life and to give you this live lecture. But as you can see, at least we can do it at distance. And I'm looking forward to the next edition, possibly where we could all be live together. So today I will be addressing the issue of healthcare environmental hygiene, looking at current knowledge, the challenge of COVID-19, and the clean hospitals model that we are currently leading, chairing, and making evolving. Now, for these, I will address three different issues: recent experience in Europe on controlling COVID-19, healthcare environmental hygiene and COVID-19, and the need for transdisciplinary and multi-stakeholder approaches, which is so important in this field. Let's start first with revisiting the current situation with COVID-19, which is, as you know, 136 million cases around the world, a total number of deaths that is around 3 million, with the worst countries speaking of the death toll being the United States, Brazil, Mexico, India, United Kingdom, Italy. And as you can see, large part of those deaths are in Europe, but of course the worst is currently in the United States, and actually from the beginning of this pandemic. The next slide shows to you data that have still not been published, that we have been generated on the behalf of the French government, because I have been receiving the mission to evaluate the management of the COVID crisis by different countries around the world. And as you can see here, you can summarize it with the mortality incidence expressed in number of days, with at least one death attributable to COVID-19 per million inhabitants in a whole year of 2020. As you can see, the worst is the United States again, with a total of 282 days, with at least one death per million inhabitants. And then classified in the descending order: Spain, United Kingdom, Italy, Belgium, Sweden, France, and so on. As you can see on the very bottom part of the slide, Vietnam, Taiwan, Korea, South Korea, Singapore, and all Asia Pacific never reached these levels. And this is important to realize these nowadays, that these COVID-19 has such a large impact on all population all over the world. So what about COVID-19 transmission? As you know, when one infected individual, there are two ways to infect others. First way is through droplets, with the virus being in the air for 1 or 2 meters, and the virus can actually be projected into the nose, the mouth, and possibly the lungs of the next person. Well, even more importantly, what we know is droplets can go on and fall on surfaces, on objects. They may be touched by your fingers or fingers of others, and with these fingers, you can actually auto-contaminate yourself or contaminate somebody else. That's why the environment is so key in the control of COVID-19, as we'll see later. Now, this brings us to the next item in our discussion, which is healthcare environmental hygiene and COVID-19. For these, it is very, very key to remember and to ask this question: do cleaner hospitals really mean safer hospitals? And the answer is actually yes. Yes, it does. Now, why is it so? It does because actually many components that we are using are efficient. Healthcare environmental hygiene is absolutely crucial for fighting COVID-19, and this is very, very well known. Now, if you look at these, you look at the many types of products that can kill COVID-19 or SARS-CoV-2, if you like. And here they are listed: heat, steam, detergents, alcohol, sodium hypochlorite, quaternary ammonium, UVGI, and so on and so on. So technically, you can kill the virus. On this list, you see enforcement policy for sterilizers, disinfectant devices, air purifiers during the COVID-19 public health emergency. You can find this guidance for industry and Food and Drug Administration staff by accessing the website, where you see the active ingredient, the product name, and different ways the product were tested, whether it would be on feline caliciviruses, rhinoviruses, avian reoviruses, and so on and so on. The next slide shows to you the EPA tool, what we call the EPA tool, that in the US again, the Environmental Protection Agency, you can access the website and you can browse products or can search for ingredient registration number, environment type, and so on, as well as the contact time for each of the products. You can go further and use automation for environmental hygiene control, which works very well too, but of course you need to get the system. The next question is hospital or healthcare environmental hygiene cost effective? The real question is, what is the cost of not cleaning? Rather than asking the opposite question, you need to ask to yourself, what is the real cost of not cleaning the environment? And you need to invest in quality, because quality is so important every day. Now, in COVID-19 times, ideally, what do we need? We need transparent masks with equal or better efficacy. We need disinfectants that work with very little contact time and are shared for safe for surfaces, humans, and the environment. We need real-time quality control that is cheap and accurate for environmental contamination. We need novel strategies to reduce human errors, and we need optimization of allocation of resources to where they are needed the most. And of course, there are many other innovations and tools under development to come and for the next future. Now, there is a debate, which is the aerosolization debate. I don't want to enter too much into the debate because it was a debate from the beginning, and the science did not evolve on this debate. As you know, the R0, the R0 for the COVID-19 is no different than any airborne respiratory viruses, and is not equivalent to airborne viruses such as varicella or rubella. The technical versus clinically urgent matters is to actually sometimes use masks that protect against droplets, but not masks that protect during aerosolization, except in few conditions. And the WHO and CDC perspectives have been summarized. For those interested, we published a paper as early as April, actually. In April of last year, we immediately published a paper putting some content to the aerosolization debate around SARS-CoV-2. It was published in the Journal of Hospital Infection, and it was the scientific team of the Clean Hospitals who published actually this paper. Now, during this COVID pandemic, we have had the COVID infodemic. Infodemic was all these wrong information that was flying all over the place in the literature, in the lay press, and so on and so on. From masks to microchips to disinfecting roads and so on and so on. We had rumors and truths that we had to fight. So for us, there was a lot of energy that we had to spend in order to actually prevent from those misinformation and even fake news to spread all over the place. Our goal for healthcare environmental hygiene is actually good education, clear protocols, direct communication, quality control, constructive feedback, and a humanistic approach. And that's the way we work into the clean hospitals model. We'll come back on this later. So last but not least, there is definitely a need for transdisciplinary and multi-stakeholders approaches in hospital environmental hygiene. And this is something that is absolutely key nowadays to keep hospitals safer. Now, clean hospitals is a new model. It's an integrative model. It uses an integrative approach. Healthcare environmental hygiene network, connecting stakeholders and leading experts from around the world, making hospitals safer through improved environmental hygiene, benefiting public health by lowering rates of healthcare-associated infections, reducing antimicrobial resistance, and protecting hospital staff, as well as the larger environment. So this is really the integrative approach of these unique clean hospitals model. The network, I would say it's time for collaboration. It should have been born earlier, but it's nowadays that we are starting this program. It's a network between experts, key stakeholders, hospitals, industry, and government. And for those who know the Clean Hands program that I had the privilege to lead for the World Health Organization since 2005, this is exactly the same approach that we are using to actually build up and construct and go further with this model. Clean Hospitals is a coalition of international stakeholders who work explicitly to promote and support healthcare environmental hygiene. Activities include education and training, specialized working groups, research, publications, and participation in conference and events, as today in Interclean China. Now, focus areas are important to recall. We are working on surfaces and environment. We are working on medical waste. We are working on air quality and air control. We are working on textiles and non-wovens. We are working on water and water control, and on sterilization and device reprocessing. So as you can see, many focus areas for the Clean Hospitals program. While the world adapts and work together towards more preventive measures to reduce the spread of pathogens and outbreaks. Well, will we do it? Well, as you can see in this pandemic, we definitively need to do it. While there is definitely the need for a change in attitude towards infection prevention and control. How to address costs and value issues is absolutely key. Improving cleaning processes and maximizing productivity is also absolutely critical. Taking a closer look at new methods and innovation in the field of hospital environmental hygiene is key, as well as develop evidence and evidence-based training and educational programs. So these are really key messages and key movement that we have been started in these clean hospitals environment and clean hospitals network. So clean hospitals really mean safer hospitals, because healthcare environmental hygiene is a key component for ensuring safety in pandemics. Of course, it ensures safety all over the year, but during the pandemic, it's even more important. We need to focus on the real dangers and evidence-based best practices. Why? Because only best practices will be the one that will, on the long term, remain the one we use. And we need to make sure that our interventions are safe and based on science and on evidence, because that's the only one that the CEOs and our other people that will actually have to decide about the cost of interventions will work with in the future. Now, with this last slide, I would like to thank the partners of Clean Hospitals that are mentioned here on this slide, and I'm looking forward to questions and to answers. It's a pleasure for me to be here, and I would like to thank you again for this invitation.